Hello, thanks for joining again for another video. Today I'm starting a whole new series. It's called Doctor to Doctor Conversations. It was inspired by the coronavirus outbreak, but I think it might expand beyond the outbreak. It was just, it's just a way to touch in with lots of colleagues worldwide to see what's happening in their neck of the wood, whether they work in hospitals or private care, just to see how they're coping, how they're managing different conditions, or just in general. So today I'm connecting with Dr. Janine Harewood. She's a Heme Oncology Fellow in New York. So let's see if we can get her online. Okay, so as mentioned before, we're here with Janine Harewood. She's an old friend of mine. She went to UE, Mona, but now she's a fellow, Heme Oncology Fellow in New York. But because New York is so overwhelmed right now, they're being pulled from that to kind of rally back on the internal medicine that she did before. So she's now covering COVID ward. So now she's in the middle. She's really at the epicenter of this whole corona thing. I mean, we are seeing cases, but I mean, 333,000 cases is huge, and what, over 20,000 deaths? All right, so just want to get an idea. A lot of us have family members in New York. New York is like, I guess, the center for tourism, and I love New York, so I want to know what's going on in New York. All right, so what's day-to-day life like in New York, like at the hospital? What happens when you get to the hospital?
Okay, so our since this whole thing started, our life changed a lot. So even the basic process of getting into the hospital, we're all screened at the door, and our temperatures are taken before we're allowed to even enter the hospital. For the purposes of us going on the COVID floors, normally your first stop is to go and collect PPE. Everyone knows the personal protective equipment. You usually get that from an outside floor, and you dress before you go on to the actual ward. They changed the whole setup of the hospital, meaning, since like me personally, we cover two different, our particular program covers two different hospitals. So you have two different experiences from those hospitals. One of our hospitals were turned completely into a COVID only hospital. So only COVID patients are in within the entire facility. The other hospital, because it was public hospital, it took other patients, but also for the most part, majority of patients are COVID. And everything was limited to geographic, meaning that you took care of all the patients on that particular floor with you and everyone else, and then the nursing staff, doctors, the respiratory therapists, all the support staff were limited to that one single floor, so that there would be a lot of back and forth throughout the hospital.
Right. So how do you keep safe? I know there's PPEs, but I mean, we have limited PPEs here. I don't know how you're procuring, like how they're doing that in the States, but what is it that you have to put on, like day to day? I mean, I have an idea, but just for everybody else.
Okay, so for basic protective equipment, normally what happens is that you would have an N95 mask. Okay, that ideally in a normal circumstance, that mask would be something that you would change out for everything, because there's so many, so limited. But those masks are usually kept up to about 5 days, and then you put a regular mask over.
Disposable N95 mask. You have to use it for 5 days.
Yes, yes.
Oh,
Yes. With and then you put a regular like a regular mask over to protect your N95 mask.
okay.
You put on a face shield. You usually put on like a head cap.
Mm-hmm.
There's a some form of gong. It could be a gong or a jumper to protect all your clothing, and then booties. And that's like the basic. So that's what the basic that you put on to put on room to room. You also try to put on another disposable gown over like your jumpsuit when you're
Right.
moving from um, uh, patient to patient scenario. But yeah,
Oh my God. That's taxing. That's taxing. Like to put on all of that and think of all of that. And are you worried like every day? Are you worried day to day like, okay, am I gonna or is it like, how normally we're just like, well, we're in it.
Yeah.
Basically, All right, so what is the ER room like? Is it like overflowing? What is going on there?
It's better now compared to that what it was like before, but the ER was pretty impressively overflowed with the amount of patients. So actually what happened at one of the hospitals, because of the volume of the ER, that then all the outpatient clinics were taken over by the ER and became an extension of the emergency room in order to increase the capacity of beds in the emergency room. And then they had to create a team just to take care of patients while they're in the emergency room before they can get up to floors on a unit.
Oh man, this is overwhelming. Question. I was going to ask this, but I'm wondering, do you see the disparity in the not really treatment, but in the number of cases, blacks and Hispanics versus whites? Are you seeing that where you are or in New York in general?
So my particular hospital is already based in a predominantly African American
Oh,
community. So
okay.
I would be able to compare like the amount of volume, because that would be what I would expect to come into the emergency room.
Gotcha. Okay. And in terms of treatment, is there any new stuff like that you guys are testing out, or is there any new protocols that you're finding that's working better than others than I mean like what you were doing before? Is there any
So
magic going on?
I wish there was magic. Everyone keeps on trying something new and hoping. The most promising thing so far to date is that they're trying to anticoagulate patients earlier rather than later based on their D-dimers, because there's like because from based on doing autopsies on other on previous patients, they noticed that there were a lot of microthrombi. So, exactly. So we've been trying to start anticoagulation as soon as patients come in and want to have like a high oxygen requirement and an elevated D-dimer, that we fully anticoagulate those patients. I think there's one study out so far by Mount Sinai that may support that this is working, but obviously with everything else that's in COVID, we don't have enough data yet to back
Right.
what's
So
happening.
managing the curve, because I think the curve is flattening. Is that mostly social distancing and mask wearing, or do you feel like it's, you know, something else?
No, so I do believe that so initially what happened was, because New York is the center for a lot of people flying in and traveling in, there was a little delay in us implementing the social distancing. So that's why we had a huge peak with regards to the volume, yeah, with regards to the volume of cases that came in that overwhelmed our healthcare system at that point in time. Um, the key will be now that everything is getting a little bit flatter, is us doing a stepwise introduction into, opening up society so that the system doesn't get overwhelmed again by,
Yeah.
yeah.
Because even in Jamaica, like everything is pretty much on standstill. But I think, not only Jamaica, just worldwide. And you're from Barbados. What's going on there? I mean, similar, right?
Yeah,
Everything.
similar. Everything's in a standstill. I think the Caribbean, for the most part, did a pretty decent job in,
I think so.
yeah,
So,
I think,
yeah,
yeah.
400 and something cases, and you literally know where we are with the cases, and the management is going superb. I don't think we give ourselves enough credit with
Mhm.
that. Yeah, I think we're doing well, but we're always meticulous and everything here. All right, so thank you so much. It was good seeing
No
you.
problem, right?
Similar, but we can tell that we've gotten a little bit more mature, all of us. So much. Be good, be safe,
You
please.
too. You
All
too.
right. All righty. See ya.
Bye bye.